Good evening. I'd like to welcome everyone to tonight's Journal Club meeting. My name is Matt Waldrop, and it's my pleasure to serve as the club moderator for tonight's Journal Club meeting. I'm a third-year family medicine resident at Wake Forest University, and I'll be starting sports medicine fellowship at the University of Wisconsin-Madison this summer. The goal of the AMSSM Journal Club is to provide a national platform for student and resident members to present an article from the list of the top 120 articles that every sports medicine fellow should be familiar with. Our intent is to make this a fun learning experience to give medical students and residents mentoring opportunities with other AMSSM members, while also developing skills of reviewing articles and making PowerPoint presentations. We're featuring one presentation tonight. The format of the Journal Club meeting is that the presenter will have about 20 minutes. That includes a brief Q&A segment after their presentation. Please enter your questions in the chat function, and then during the Q&A, I will read each question entered in the chat and ask the presenter or the club mentor to respond. Feel free to enter those questions in mid-presentation. Just know that we'll get to them at the end. So with that being said, I'm pleased to introduce our featured presenter tonight, Dr. Timothy Huang, and his club mentor, Dr. Mark Troxler. Dr. Huang is a second-year family medicine resident at Middlesex Health Family Medicine Residency in Connecticut. His sports medicine interests include diagnostic musculoskeletal ultrasound and expanding access to care for underserved communities. After finishing residency, he hopes to complete a fellowship in primary care sports medicine. A recent pickleball enthusiast, attaboy, he now plays weekly and enjoys the sports blend of strategy, movement, and fun. That's my guy right there. His presentation is on the article ACSM Position Stand, Exercise and Physical Activity for Older Adults. I'd also like to thank Dr. Mark Troxler for serving as his club mentor. Dr. Troxler is in private practice at McKinney Internal Medicine and Sports Medicine in McKinney, Texas. He is the chairman of Anti-Doping Education Committee for USA Track and Field. He has served as a team physician for youth, high school, college, Olympic, and professional athletes. He completed medical school at Oklahoma State University College of Osteopathic Medicine in Tulsa, Oklahoma, and completed his internship year of residency at Hillcrest Health Center in Oklahoma City, Oklahoma, and his internal medicine residency at the University of Oklahoma College of Medicine, Tulsa campus in Tulsa, Oklahoma. Dr. Troxler completed his sports medicine fellowship at Jersey Shore University Medical Center and Rutgers in Neptune, New Jersey, and received an MBA at the University of Massachusetts Amherst campus in Amherst, Massachusetts. With that being said, Dr. Huang, the floor is yours.
Thanks so much, Dr. Waldrop. So as we said, today's article will be ACSM, the position stand, exercise and physical activity for older adults. So why is this important? So the last publication of the exercise and physical activity was back in 2007, and it's been quite a while. So since then, there's been a lot of additional evidence that looks at exercise and physical activity for various chronic diseases and disabilities. And the two exercise modalities that have the most data right now are aerobic exercise and resistance exercise. So this is more of a position stand, and it breaks it down into three different parts. So one, it looks at how people change with normal aging. The second part is influence of exercise on the aging process. And the third part looks at the benefits of long and short-term exercise. So with that said, there are a couple of definitions I want to go over. So the first is physical activity, which is defined as body movement produced by the contraction of skeletal muscle that increases energy expenditure. And we have exercise, which is planned, structured, and repetitive movement to improve or maintain one or more components of physical fitness. So the big difference is like physical activity can be anything from like mowing the lawn, whereas the exercise part is like going out and actually kind of with that intent of doing something. Aerobic exercise, aerobic exercise training is exercise in which the body's large movements move in a rhythmic manner for sustained periods. And we have resistance exercise training, and that's when exercise causes the muscle to work or hold against an applied force or weight. And so with this article, they looked at four different levels of evidence. So level A, we have strong, consistent evidence from multiple randomized controlled trials or observational studies. Level B also has similar type studies, though every now and then some studies would have conflicting information or conflicting results. Level C has limited or suggestive evidence from fewer and less rigorous studies. Um, and level D essentially saying there isn't really enough evidence for any like big conclusions to be drawn from that. So with that said, the first part, normal aging, normal human aging, structural and functional decline. So it looks at how advanced aging is associated with physiological changes that result in reductions in functional capacity and altered body composition. So essentially, they found that baseline values of maximal aerobic capacity and skeletal muscle performance predicts our increase in chronic diseases, disabilities, and death. And what they found were that older adults often had to exert a higher percentage of their maximal capacity and their effort when compared to younger people. Um, our bodies tend to change as we start to get older, and so we have this accumulation of body fat and its redistribution to the central and visceral areas during the middle age. And we also start to see loss of muscle during middle and old age, with additional metabolic and cardiovascular disease risks. So this was kind of a big table that essentially showed the various changes in structure and function. And so just to highlight a couple of those bigger points, in looking at muscle strength, it declines significantly after age 50. So strength loss can accelerate up to 3% per year after age 60. And power declines even faster. And so strength is the maximum force a muscle can generate, while power is essentially the ability to exert that force quickly. Some other interesting things from this table where cardiovascular capacity drops with age, max heart rate and VO2 max decline steadily. And then just another one that I thought was interesting was pulmonary and oxygen utilization efficiency decrease. Our lungs become stiffer and gas exchange becomes less efficient. So older adults take longer to reach peak exercise capacity and recover a little bit more slowly. This is just a continuation of that table. So as we get older, we generally just have a decline in physical activity. They had this survey where it was by self-review, self-report, or interviewing, and they just essentially found older populations are less active compared to younger populations. Total time spent per day in exercise and lifestyle physical activities um, did sometimes still approach that of younger, normally active adults, which I thought was kind of interesting. And the types of activities that are more popular were consistently lower intensity. So they would cite things like walking or gardening, sometimes golf, essentially lower impact aerobic activities compared to younger active adults. I think this one is something that we've seen and is not too crazy to think about how as we get older, we are just more increased of a chronic risk disease. So the relative risk of developing chronic disease increases with age, and we see that statistically significant um, decrease in the relative risk of cardiovascular and all-cause mortality among people who are considered classified as like highly fit. So people who are exercising more regularly and compared to those in a similar age range who are classified as moderately fit or low fit. What's interesting is the largest change in difference in mortality benefit is seen when comparing sedentary adults with those in the next highest physical activity level. So essentially, being sedentary is significantly worse than any type of exercise. And avoidance of a sedentary lifestyle by engaging at least in some daily physical activity is recommended to reduce the risk of any of these chronic diseases. And so we have like very common ones like diabetes, osteoporosis, heart disease, obesity, arthritis, some of these general chronic diseases. In this next part, they looked at what factors affect aging. And so we have like primary aging processes and secondary aging effects, which that is defined as like resulting from chronic diseases and various lifestyle behaviors. Um, Primary aging processes, the natural, inevitable biological changes that occur as a result of aging process, regardless of lifestyle or environmental factors, and secondary aging, which is from chronic disease and lifestyle behaviors. Um, so some other things that they found was in some of these twin studies. Um, they looked at exercise training studies involving families and twin pairs and reported a significant genetic influence on baseline physiological function. So this next part was looking at how exercise is affected. So this was pretty interesting. Older adults have preserved acute responses to exercise. So even in sedentary but still healthy adults, the body is still able to respond effectively to aerobic and resistance exercise, which I thought was interesting. Essentially, our cardiovascular and neuromuscular systems were still able to adjust during physical activity so we can maintain blood pressure, oxygen delivery, and body temperature. So just like kind of in still younger folks. What was interesting is that older adults, the kind of objective numbers like muscle size might not be as large of an increase, but the relative improvement, so like from their baseline, is almost the same. So I thought that was interesting because it's essentially showing that our bodies are still responsive to some degree of training. Um, it's important to know that older adults, they still might take a little bit longer to hit their fitness goals, but eventually they can still get there. Essentially, our capacity to improve and get better is still there. It just takes some time for us to get there, a little bit longer as we get older. What we did find was that there's a little bit of a limitation under heat and cold stress. So it looks like older adults have a lower tolerance for exercising in extreme temperatures. And then another thing is how we decondition really quickly with inactivity. So they looked at how cardiovascular and metabolic fitness is lost when older adults stop exercising. But the good news is that strength training gains tend to stick around longer, even with a break. So this next part looked at what do successful aging, what does that look like? And so they studied centenarians, and these are people who live past 100. And some common themes we see in these people, they stay active, they stay connected, and they stay positive. If you know anything about the blue zones, these are essentially places where people live a lot longer. And these are some of those themes where exercise is central to that longevity. Physical activity helps control our blood pressure, reduces our abdominal fat, it improves our ability for our insulin, and it supports some healthy cholesterol. So these are all key markers of aging well. Physical activity often benefits both the body and mind, helps improve mental health like anxiety, depression, it boosts their social engagement, and that becomes really important as people age longer. We tend to just become a little bit more lonely. I think I've heard a lot of just some of my older patients say, hey, I'm like the only one around left in my community. It's just a natural part of aging. And regardless of genetics, staying active consistently sets apart those who age well. It's one of the few lifestyle choices that support nearly every system in the body. And then also for some treatment and management of just chronic diseases, movement is very therapeutic. It helps us control, like I said, our blood sugar, our blood pressure, and eases arthritis, and then ultimately lifts our mood. And because of that, it's now part of the treatment guidelines for various diseases like heart disease, COPD, depression, back pain, like even fibromyalgia, constipation. It's a very essential part of chronic care. So this is the third part of the study, which I thought was the most interesting. It looks at how different athletes, they look at aerobic athletes, they look at resistance training athletes, and they look at how physical activity affects kind of their long-term health. And so the first part, we have improved body composition and body mass, bone mineral density. Older adults who do stuff like running, cycling, or swimming, they have huge physiological advantages compared to their sedentary peers. Carry a lot less total abdominal fat. They have more muscle mass and stronger bones in those weight-bearing areas. Their muscles are more fatigue resistant and efficient at using oxygen. Their heart can pump more blood with each beat. Their heart filling patterns also tend to resemble those of younger adults. There's lower submaximal exercise stress. So at the same workload, they're less stressed than their untrained peers. And they have a better coronary risk profile. So that looks at lower blood pressure, healthier cholesterol numbers, lower inflammation, better glucose regulation, and just overall a smaller waistline. And the last part, slower functional decline with age. Neurologically, aerobic athletes, they maintain faster nerve conduction velocity, and they experience disability more slowly as they age. So long-term aerobic exercise really isn't just about fitness. It slows so many other aspects of physiological aging and also just provides some great cardiovascular protection. And so this next part looked at what does it look like to be a resistance-trained athlete. There's fewer studies on resistance-trained athletes, but the benefits are still there. Older adults who lift weights, they have greater muscle mass and strength. Some of the studies showed maybe about like 30 to 50% more strength. They tend to be leaner. They have higher bone mineral density, and that's key in preventing fractures, maintaining mobility in later life. When compared to older aerobic athletes, the resistance-trained individuals have more total muscle mass, stronger bones, greater muscular power and strength. And these benefits are really important because it's essentially telling us aerobic exercise alone doesn't consistently preserve muscle and bone the way resistance training does. And so this next part looks at what does it look like to have aerobic exercise in patients who are sedentary. Aerobic exercise training improves VO2 max by about 16% in 16 to 20 weeks. So when older adults engage in aerobic training that's frequent and intense, and think about like 3 days a week or 3 days a week essentially, we see some real improvements in aerobic capacity. Essentially, VO2 is the maximum rate that your body can take in, transport, and use oxygen during intense exercise. It's considered one of the best indicators of cardiovascular fitness and aerobic endurance. And so it's essentially telling us our body is more efficient at using oxygen and allowing you to perform sustained aerobic exercise at higher intensities. Improvements are greater if the training lasts longer, say like if you keep doing this for like 5 to 6 months. But it looked at how bumping the intensity higher didn't always mean better results. And even older adults at like 75, they can still benefit, even though the gains tend to be a little bit smaller. What I found was pretty interesting. Both older men and women improved similarly, but how they got that benefit was a little bit different. Older men saw an increase in cardiac output and oxygen extraction, whereas older women increased their ability to extract and use oxygen at the muscular level. And so this they looked at various studies at the cardiovascular effects of aerobic training in sedentary adults. After just around 3 months of moderate aerobic training, we saw cardiovascular adaptations in lower resting heart rate and lower submaximal heart rate. Heart rate dropped with just normal everyday exertion, and even blood pressure didn't spike as much with activity. We see our blood vessels' ability to adapt. They're able to dilate better, deliver more oxygen to the muscles, and overall cardiovascular efficiency tends to improve. And then just like we talked about earlier about the cardiovascular profile, just better lipid profiles, less arterial stiffness, um, improved endothelial and baroreflex function, and increased vagal tone. So this looks at aerobic exercise training in sedentary individuals and how it affects the body composition. So we see AT reducing total and visceral fat. Um, we typically gain a lot of fat from the age 18 to 55. They said about 8 to 9 kilograms and a bit more after that. And aerobic training, even without dieting, showed to offset this. So studies show fat loss in the range of 1 to 3 kilograms over a few months, especially with patients who continue to do aerobic training. One of the most important effects is this reduction in visceral fat, which is like fat around the organs. It's strongly linked to cardiometabolic risk. When it comes to building or maintaining fat-free mass, aerobic training doesn't do as much. So it doesn't stimulate enough muscular force to lead to significant muscle growth or strength gains. And so even if it's good for trimming fat, AET just doesn't build muscle as well on its own. Next, we'll look at some of the metabolic effects. So I spoke earlier about just a little bit about improved glycemic control, our ability to clear lipids after meals, shift the fuel during exercise, so muscles burn more fat and spare carbs. Older adults still respond well to training at the cellular level, even into their 60s and 70s. And it showed that intensity of the exercise does matter. So both moderate and high intensity training improve things like glucose transport into the muscle, but higher intensity seems to have a stronger effect on improving insulin sensitivity across the whole body. And so just saying, even though it's important to exercise in general, the intensity actually does make a difference in these metabolic effects. And so looking at bone health, and this is still continued with aerobic exercise training. Low intensity things like walking can slow bone mineral density loss, especially in postmenopausal women. But it showed that it might not actually increase bone density. So they can maintain it and reduce fracture risk. For better results, especially in short term, we look at things that load the bones. So things like weight bearing, AT, like stair climbing, walking with weights, or even jogging. Those showed to produce some more better improvements in bone density. And what was interesting is we didn't really have much data on men, but there was one study that showed that men who ran regularly had slower bone loss in the spine compared to their less active peers. So this next part looks at various effects of resistance exercise training. And so strength gains were measured by 1 rep max or 3 rep max or isometric and isokinetic exercises. They showed it was interesting. Older adults really have the capacity to gain a lot of strength. Sometimes, up to 25%, but even, up to doubling it with just resistance training. Factors like sex, which muscle group you're targeting can influence how much strength is gained. This next part looks at muscle power, and muscle power is force divided by torque times velocity. So essentially how much you can generate in a set amount of time. It's really important because power tends to decline faster with aging, and power is really important for functional tasks. So if we think about needing to generate that amount of force to go upstairs, or catching yourself if you fall, these are all aspects of muscular power. And the good news is, even if it's declining with aging, they did find that high velocity RET does improve power. So we can still improve it as we age. So this next part looks at muscle quality. Essentially, how much force can your muscle produce relative to its size? Um, they saw that resistance exercise training, adults see some big improvements. So even if the muscle mass itself doesn't increase as much, they still showed that the muscle quality itself was really healthy. The hypertrophic or the the enlarging of that muscle, the response is diminished, even when the muscle quality increases are similar between the older and younger men. The idea behind this was there is some idea of improved motor unit recruitment. There's some better coordination of using specific muscles that are, for an action versus muscles that are against an action. There are some fiber type changes, and they saw this consistently across both sexes. Next part they looked at was muscle endurance. So our ability to repeat movements over time improves with strength training, even though it's just been studied a little bit less. And one really important part about this was the intensity that they looked at. They found that moderate to high intensity resistance exercise training works, whereas low intensity does not. The next part, they looked at effects on body composition. So resistance training tends to increase fat-free mass in older adults, especially with higher intensities. Men show greater absolute gains, but what was interesting when you adjust for the actual baseline of compared to women, the difference between men and women disappears. So essentially, it's telling us the relative gains are the same. What was interesting is these gains aren't just muscle weight. Sorry, these gains aren't just water weight. RET improves both muscle and bone tissue. And then another thing I want to mention and get a chance to mention about these muscle fibers. RET increases muscle cross-sectional area and volume through the growth of type 2A muscle fibers. And so these are the fast twitch fibers that can support strength and power. And interestingly, they saw type 2X fibers decrease. And so these are the fibers that are involved in explosive movements. And they saw that type 1 fibers remain unchanged. And just looking at muscle endurance, it was a little less studied, but it's still improved with RET. We see gains up to 200% with moderate to high intensity. And some other forms of exercise that I thought were interesting to mention were just balance training and stretching and flexibility training. There isn't particularly great evidence, but they still commented a little bit on this. So the most research that was done in older adults were already at higher risk of falls, so like those with osteoporosis or prior fall history. Even though we don't have strong data, we do see that exercises like strength training, walking on uneven surfaces can improve balance pretty consistently. The best outcome comes from multimodal programs. So those include things that look at strength, balance, flexibility, and walking. And these are really especially helpful when they're tailored to each individual. And also, we've also seen that Tai Chi has some pretty good evidence as well. It's shown to reduce injurious and non-injurious falls. When looking at stretching and flexibility training, as people age, joint range of motion just tends to decrease. That's linked to some reduced mobility and independence. Not a ton of studies, like I said before, on flexibility training, but the ones we do show solid improvements with consistent static stretching, especially in areas of like the low hip, low back, and hamstrings. And then they found programs that combine stretching with rhythmic full range movements like yoga or Tai Chi can also seem to improve flexibility in the shoulders, knees, and ankles. And that said, we still don't really know how often, the best frequency for any of this like stretching, dynamic, or static is effective, and we just need more research to kind of sort that out. The relationship between exercise and real life function can be a little tricky. Some studies showed better walking speed or stair climbing after training. Others kind of showed no change, and a lot of these functional gains were kind of specific on kind of what you're trying to do. So strength training can help with walking, standing from a chair, and balance, but it might not improve some other tasks like stair climbing unless those were specifically trained and for those tasks. Um, so this principle of specificity really matters here. People get better at what they practice. So if the goal is to improve a specific daily activity, like standing from a chair, that exercise program really needs to mimic and have that part of what they're trying to do. Um, and then they did show there's some evidence that maintaining cardiovascular fitness is linked to staying functionally independent over time, but that relationship is still being figured out. And so this last summary table of this article showed the various different kind of stances, their little points, and what the level of evidence showed. Just some interesting things. Most of the recommendations were related to aerobic and resistance training, like improvements in cardiovascular fitness, strength, and muscle mass. These have moderate to strong evidence, like A or B. For example, high intensity resistance training improves fat free mass and bone density in older adults. It's a level B recommendation. They also found aerobic training consistently improves VO2 max and cardiovascular health in older adults. Several A level recommendations there. And some other promising fields like flexibility and cognitive benefit also have some promising support, but lower or mixed evidence. So more research needed there. So even though there's individual variability, both aerobic and resistance training are effective across a wide range of older adults. It enforces the idea that it's really just never too late to start exercising. And so overall take-home message, moderate to high intensity exercise has strong evidence for improving body composition, cardiovascular fitness, and function in aging adults. And they're still developing but encouraging support in areas like mood, cognition, and balance. And so just some last take-home points. Even though we can't stop biological aging, regular exercise plays a huge role in slowing its effects, especially those that come from a sedentary lifestyle. Staying active helps older adults live longer, healthier lives by preventing or delaying chronic disease and disability. As shown before, there's like various differences in gains in terms of aerobic exercise versus resistance exercise. So it's really a combination of both aerobic and resistance training that's more effective than just doing one over the other, especially if we want to maintain cardiovascular health and muscle function. That said, high intensity workouts see benefits, but you don't always need high intensity workouts. There are various studies that show moderate exercise was enough to prevent disease. But perhaps maybe for patients who have conditions like diabetes or depression, who already have some of these chronic conditions, higher intensity exercise can show to be a little bit more effective. And then another aspect, benefits are quickly lost after stopping. So the key takeaway there is consistency really, really matters. We have to be encouraging exercise, not just once a month, but really consistently over a span of like years if we can. Exercise plans should be tailored and personalized. People just respond differently to various exercises, and sometimes patients just have different goals. So, like talked about earlier, if a patient's goal is just to be able to get off out of their chair, focusing that exercise regimen to be more focused on trying to get them out of their chair and trying to practice that movement. And bottom line, regular physical activity is essential for healthy aging, and promoting it is super important, especially because as we can kind of see and as we know, Older adults are our least active group. So just as we wrap up, resistance anaerobic training, it's safe for older adults, and it's one of the most powerful tools we have to promote healthy aging.
Awesome. Thank you, Dr. Huang. For moderating the Q&A, I'd like to give your club mentor, Dr. Mark Troxler, an opportunity to share any additional comments about the article or this topic in general.
We talked a little bit about it yesterday, and a lot of our journal club meetings, we'll do an article about the knee or the elbow or the foot, and these are the hardest to do, and they're a little bit different because there's so much information, especially with these position statements. And this is probably one of the better ones because I can say confidently to patients that here's proof that physical activity works, especially for older people. And these patients who are physically fit tend to have, less hypertension, less diabetes. They have less osteoporosis. They tend to have less hip fractures. Um, and especially table 4 really gives a good outline of all the benefits of exercise. And there's not really whole lot of D's in here, mostly A's and B's. And so there's just so much information about it. I really like his presentation, especially with the cartoon characters and the simplification of it. Taking a very difficult, detailed article and simplifying it was very difficult and time-consuming job. And he made this journal club a lot more enjoyable because of that. And I really appreciate all the hard work he's put in it and a great presentation.
Awesome. Thank you very much. All right, now I will moderate a brief Q&A. Please feel free to throw any questions in the chat function and I'll read them aloud. I'll start with this one. For an older adult who is not currently exercising, do you have like 1 or 2 specific recommendations based on this article that you'd feel confident given during any typical, quick 15-minute clinic visit for one of your older patients who might be asking about this?
Yeah, so I think there was one look at just very low intensity exercise. They're looking at just anything because looking at sedentary versus that next level up was already a significant difference in benefits. And so if we're talking about low activity, we had those adults who were like just gardening or just walking. Anything is better than nothing.
Awesome. Thank you. And one more. So it looked like balance training is recommended for older adults at risk of falls, but it noted that there's not really firm guidelines on a frequency or type, maybe some evidence for some Tai Chi. Do you have any way that you might think about integrating balancing exercises into a typical visit for an older adult, especially if they have any sort of limitation to time or access to formal PT, for example, transportation barriers, costs, that sort of thing?
I think I might have to ask Dr. Troxler to comment on this. I don't know exactly specific things that I could recommend right now. Yeah, I'd have to call on some help.
Dr. Troxler, do you have anything to add as far as any recommendations if you had a short amount of time and a quick visit with an older adult as far as balance training goes?
Um, the way my office is set up, we kind of share a space with a chiropractor and a physical therapy. And so I'm kind of in a atypical situation is I can just walk them over to the therapist. And before this, I'd have to do a lot of the home exercise programs myself, but now I can just walk them over and have them do it. And so I'm really fortunate to have the physical therapist, and they can do all that for me.
Awesome. Yeah. Well, I'd like to thank Dr. Timothy Huang for this excellent presentation. Thank you so much for doing this. And thank you to Dr. Mark Troxler for serving as the club mentor. And thank you all for attending tonight's AMSSM Journal Club meeting. Looking ahead, we will have a journal club meeting in June. Date and time will be announced in an upcoming edition of our all-member e-blast, also known as the AMSSM Digest. Otherwise, this concludes tonight's meeting. Thank you again to Dr. Huang for this awesome presentation, and have a great night.